back with Dr. Bensianoff. Dr. Bensianoff, let's talk about gum disease, periodontal disease. Now, I have a very, very, very specific question right off the bat, and here's what I constantly hear dentists saying. When you have gum disease, you obviously lose your gums and all that, and you will lose your teeth. And that is kind of the main major bad thing which dentists push of what's happening with gum disease. Now, while I'm sure that gum disease is losing your teeth is a bad thing, at the same token, however, if money is not too much of an object or whatever, you can fix teeth. You dentists do a wonderful job to put in implants. Even a full mouth denture these days can be somehow mixed up with implants and can be made pretty good with not too much money. Now, so you can fix it. We're not anymore in the time where apparently George Washington had a wooden tooth. That must have been awful. If he did, I don't know. But while you're losing the teeth, which may take anything between, 1, 5, 6 and more years, you have a disease. You have an infection in your mouth, which is at the gateway of the blood vessels. It goes into the blood. It poisons the kidney. It poisons the liver. We know and have heard that gum disease causes heart attack, of course, because it poisons the kidney, the blood, and the liver, and strokes. We have heard that ladies get premature babies and then the baby is born underweight. If it does all that, the immune system must be drastically going down for these bad things to happen. So the everyday cold, flu, the influenza, maybe even being energetic, all must be at stake while you have a gum disease. For years, minute by minute, poisoning your body. It looks to me, and you tell me whether there's any bearing to what I say. It looks to me that this poisoning of the body is a lot worse than losing the teeth, because at least with $5,000, $10,000, $20,000 you can fix them again. So no big deal. But the poisoning, how do you repair your kidney, your liver? How do you get an underweight baby? How do you put a price on something like that? Tell me, am I way off? How way off am I?
Well, you're right on track. The research shows that people that have teeth, they live 10 years longer than people that don't. And that's an indication for a lot of different factors. The biggest one of them is being a gum disease. People are not aware of the gum disease because most of the time it's not painful, it doesn't hurt. So what if your gums bleed when you brush? But it's a constant source of all kinds of different toxins that are being produced by bacteria that's sitting under the gum and causing gum inflammation, which leads to bone loss and periodontitis, which is the bone loss around the teeth. And there is definitely a correlation which has been proven and has been found between the gum disease and the heart disease, as well as women with gum disease give birth prematurely, or to babies with lower birth weight. So it is definitely, it's not like it's the oral cavities outside of your body. Everything is interrelated. And therefore it's essential to keep your gums healthy as well as your teeth.
So what I told you about, the premature babies and poisoning the body, because you have that yellow, ugly pus. That's what an infection is. It's like if you cut yourself in the hand, you get this, and if it gets infected, you get that yellow, reddish, ugly, pus. Well, that's what you have in your mouth, and it just drips into your body faster than from any other body part, because if you want to wake a person up who is kind of like unconscious, go and put something under his tongue and he goes, ooh, right? Because it goes right into the blood vessel. So that poisoning, that yellow pus travels right. It has one foot to the brain, one foot to the heart, and of course from there it goes everywhere else. So you're saying I am right with what those other people say, that premature babies and all that stuff.
Yes, you're absolutely right, and it's been proven, and it is a fact that, infection in your mouth can lead to very severe complications. And sometimes we develop those swellings, and they can eventually, the worst case scenario, they can lead to death, which is not the situation with the gum disease, because most of the time it's chronic, meaning it doesn't happen over 1 day or over 2 days. It's a constant ongoing disease, and it comes in spurts, meaning there's can be a period where nothing is happening, and then there's an active process of bacteria acting up. Unfortunately, at this point, we don't know when this active process starts, so it's essential to come in and have your teeth checked and your gums cleaned every 6 months.
Well, I mean, besides of that, probably any person with a gum disease couldn't possibly have a too clean, beautiful of a breath too much. He must be having a stinky mouth on and off continuously. But again, if it can cause all these bad things, it probably weakens the immune system on a daily basis. And then when you get a flu season, the person most likely is more susceptible to it. It can get it easier. As you mentioned, as you mentioned with they kind of like, slowly, getting sick, and people who have, then you lose your teeth, and it's proven that people who don't lose your teeth live longer, and I've heard that from many places. So very obviously, how detailed it is proven doesn't really matter, because the big picture shows this, it's happening. In fact, lately more and more surgeons who do any type of surgery, from appendix operation to hip replacement to whatever it is, they will not do the surgery anymore if the person has gum disease, because they say the body is too much pre-weakened. If the body has gum disease, we need to first fix the gum disease, because otherwise we are straining the body too much. Have you heard about that also?
Oh, absolutely. I get patients, not on a daily basis, but once in a while I have a patient who is about to have a major surgery done, and they always need a clearance from the dentist as far as any infections or gum disease. So absolutely, it's all related, and it is the case where, in order to have a big surgery done, a lot of times you need to be cleared dentally for that. And the reason for that is all kinds of infections that can be going on in the mouth, and that can affect your whole body. Wow.
Well, again, very informative. Thank you for being candid. It definitely, I hope that the viewer listening to this really do realize that, gum disease is a bad thing. And it looks like, look, I mean, you dentists, you talked about that, maybe headaches and muscle tensions can be fixed from missing teeth. We have, you mentioned in another video how if your teeth are missing too much, and like people with dentures, that's how they lose and get a caved-in face, how our grandparents looked, because they're losing all their bones. So, a dentist is a plastic surgeon, is a guy who can fix your headache and now even extend the life. I mean, most of us look at dentists only, look relatively good because it's ugly enough to have teeth in front, and have no pain. And that's really kind of the extent most of us still feel is the mouth for. It just doesn't seem to be like that. I mean, the interaction between the whole body is enormous and makes sense. I mean, after all, just the head, everything in here is important. You understand? Why would something in it not be important? All right. Thanks a lot, Dr. Bensianoff. I hope that patients go and do the most important thing in dentistry, which is making sure they have no periodontal disease, no gum disease, no gingivitis, all the same thing, just slightly, different gradients, because it's devastating, as we said. Bye-bye.